Welcome back to Aging is for Everyone. Today's whole show has been all about having that conversation about the kind of care that we want at the end of our lives. Here from Hospice, the Center for Hospice and Palliative Care, is Rosemary Collins, their Director of Public Relations and Community Marketing. Welcome, Rose.
Thank you for having me.
It's great to have you. We talked a little bit about having the conversation, talking with our families. Now, once we've done that, we obviously want to have it down in writing, some of those things that we do and we do not want. So what are some of the forms and some of the medical forms that we could fill out to let people know, let our doctors know, let other health professionals know?
Sure. Well, it's really important, especially in New York State, to have a healthcare proxy. And what that is someone you appoint that you trust to make medical decisions for you when you can't speak for yourself. So healthcare proxy forms are available really at any doctor's office, in hospitals and libraries. You can download them online. There's several sites, but one of them that is real local actually to our Western New York region is sharingyourwishes.org. And that is really helpful because it walks through the steps of how do you appoint an agent, what are some important things to consider when you're appointing an agent, such as you want someone local, you want someone who's going to advocate for you on your behalf, you want to have talked to them ahead of time. Earlier on in the show, you may have heard people mention that, gee, I really didn't know what mom or dad wanted. And, this is what we're trying to prevent is for more people to know, Laura, that this is something they should have from age 18 years old and up.
Right.
I have one, my son has one now, he's age 22, and it's really important because Terry Schiavio was very young.
Right.
Karen Ann Quinlan was young, and you hear of people all the time that never had this conversation, and yet, they're in a persistent vegetative state, the family is distraught, it goes through a court battle, etc. And had they had these conversations early on and regular, a very tragedy could have been prevented.
Right. Now, in addition to the healthcare proxy, there's a form called the MOST form. Can you tell us what that is?
Sure. This is pretty new to actually New York State. In 2010, the MOST became law. MOST stands for the Medical Orders for Life-Sustaining Treatment. And you can learn about MOST online. Just type in MOST or type in compassionandsupport.org. That is a wonderful site that is full of great information about MOST. It has videos and what that is about. What makes it important, Laura, is that this is a medical order that actually travels with you. So, for example, if someone is in the hospital and they have a MOST order, it travels with them to the nursing home.
Right.
And vice versa. It goes to home care as well. So the medical orders for life-sustaining treatment can only be filled out by a doctor. You can have a conversation with a nurse or a social worker, but the doctor must sign it and they must review it. Usually every 60 to 90 days they're reviewing it.
Right.
What's nice about that order, again, is it stays in the medical chart and it travels with the patient. So that's really important.
Right. And what are some of the specific health issues that the MOST addresses?
Well, the MOST would actually find out, what's important to that person. If they are seriously ill or they have a lot of conditions going on, we call that multiple comorbidities. They have a lot of things going on. They can determine if they want to be resuscitated,
right,
or do they want antibiotic treatment? Do they want a feeding tube? Do they want to be at home for their care? Do they want to be in assisted living or move up to a skilled level of care, nursing home care? So there's a lot of different conversations. The MOST form kind of walks people through those steps.
Right.
It's done over time. It's certainly not done in one sitting.
Right.
Just like in your show, we recommend people have a regular conversation. Maybe it's at Christmas time or during Thanksgiving time when families are together.
Right.
They can have this conversation.
Right.
And be able to discuss what's important to them. One of the things we really like to recommend, Laura, is that people think about what's important to them. And one of the ways to actually make it more and less threatening for people is to try a card game.
Yeah.
And there's a wonderful site called gowish.org, and it has a lot of value statements on it, and it's kind of like a go fish game. This is Go Wish.
Go Wish.
And for example, one of the levels is to maintain my dignity, to have a nurse I feel comfortable with, to be able to help others. So it asks the person, what's important to you, and could you rank that? Is that like your most important value that you have, or one of your 10 most important values? And this way, if you become my proxy, I can say, you know what, these values are really important to me, Laura. Can you help me make this happen?
Right.
To the best of your ability, will you speak on my behalf when I can't talk for myself?
Right.
So we encourage people to make it less threatening by having this card game, or talking to your loved one over a cup of coffee, and just saying, I'd really like to bring this up again when you're more comfortable with it, but it's important to me, because if we don't talk now, I'm going to have to make a decision when it's a crisis, and that's when you don't want to be having these conversations.
And I'm sure that in hospice you see that quite often with people having to make those decisions.
We do.
Way too late in the game.
We really do, and I think that's probably why I'm a big advocate for it, is because I see families very distraught, and yes, while their loved one is seriously ill, they have a terminal condition, it's important that while they're still with you and they're alert and they're able to communicate, talk to them. Let them share with you what's important, before they become unable to talk.
Wonderful. And people can get guidance at Sharing Your Wishes.
Yes, sharingyourwishes.org or gowish.org. They're wonderful sites for getting information, going to the library, talking to your doctor. We encourage that as well.
Right. Well, thank you so much for being with us.
You're
we appreciate
welcome.
It's been an important conversation today.
Thank you.
And thank you for being with us. We'll see you next month for more Aging is for Everyone.